On November 18, 2025, the Ohio government engaged in several significant actions across regulatory, legislative, enforcement, and public service domains. 1. Regulatory action on environmental program. The U.S. Environmental Protection Agency, EPA, proposed approval of Ohio's application for expanded authorization under the Resource Conservation and Recovery Act, RCRA program. This includes new authorizations covering organic air emissions standards, revised definitions of solid waste, national emission standards for hazardous air pollutants, and the addition of aerosol cans to universal waste regulations. Ohio EPA will serve as the primary enforcement agency for these regulations, reflecting Ohio's adoption of federally consistent rules. The EPA is accepting public comments on this proposal until December 18, 2025. 2. Legislative activities. The Ohio House Education Committee passed changes to House Bill 485, known as the Baby Olivia Act, which requires public high schools to show a 3-minute video on fetal development produced by the anti-abortion group Live Action, or a substantially similar video annually. The bill also requires schools to provide instructional materials related to human growth and development to parents before showing the video, and allows parental opt-outs for students. Democratic amendments were rejected, and the bill was scheduled for a full House vote on November 19, 2025, before Senate consideration 4-5. The Ohio legislature prepared to vote on legislation that would end the grace period, allowing mail-in ballots to be counted if they arrive within 4 days post-election, requiring mail-in ballots to be received by 5 p.m. on election day itself. The bill, SB 293, advanced through the House committee and was expected to be voted on promptly, with the Senate and governor to follow. This change was aimed at aligning Ohio with most other states and was supported by Secretary of State Frank LaRose. 3. Public health and behavioral services expansion. Governor Mike DeWine announced the statewide expansion of the Mobile Response and Stabilization Services (MRSS) program, which provides no-cost immediate in-person crisis intervention for youth experiencing behavioral health emergencies. Previously available in 56 counties, MRSS now operates in all 88 counties, serving children and young adults up to age 20. The program includes tele-response after hours and aims for 24/7 mobile response availability by 2028. MRSS also functions as a gateway to the Ohio RISE Comprehensive Care Coordination Program. From July 1, 2024 to June 30, 2025, MRSS handled over 10,000 calls, with suicidality and family conflict as leading reasons for intervention. 2. 4. Supreme Court engagement on reentry resources. The Supreme Court of Ohio highlighted resources for reentry employment services aimed at former offenders to facilitate their reintegration. The Ohio Department of Rehabilitation and Correction, ODRC, provides support such as Certificate of Qualification for Employment, CQEs, to reduce employment barriers for reentering individuals. 6. 5. Other legislative procedures. The Ohio Senate General Government Committee convened at 2:00 p.m. on November 18, 2025, to receive testimony and discuss general government matters, though no detailed actions or outcomes were specified. 8. No major enforcement actions or additional public events were reported on that date beyond those described above. Key agencies involved included the U.S. EPA, Ohio Environmental Protection Agency, Ohio General Assembly, House and Senate, Governor's Office, Ohio Department of Behavioral Health, Ohio Department of Rehabilitation and Correction, and Ohio Secretary of State's Office. Officials referenced include Governor Mike DeWine, Secretary of State Frank LaRose, and various state legislators spearheading the bills mentioned. Overall, November 18, 2025, in Ohio was marked by regulatory advancements in environmental oversight, significant legislative developments in election law and school health education policy, expanded behavioral health crisis intervention services statewide, and judicial emphasis on offender reentry assistance.